Having familiarized yourself with the specifics of adhering to the CAB method and executing compressions, opening the airway, and providing breaths, let's combine the adult CPR technique. Ensure the safety of the environment and use personal protective equipment, PPE, if available. Gently tap on shoulders and loudly ask, "Are you okay?" to assess the victim's responsiveness. Call for assistance if available. Activate Emergency Medical Services, EMS, and retrieve the AED. Check for signs of breathing by looking, listening, and feeling for at least 5 seconds, no more than 10 seconds. Administer 30 chest compressions, maintaining a depth of 2 inches. Open the airway using the head tilt chin lift technique or jaw thrust technique. Provide 2 breaths, each lasting 1 second each. Continue the cycle of 30 compressions and 2 rescue breaths until help arrives, aiming for a rate of 100 to 120 compressions per minute. Don't forget to reassess the victim after 2 minutes for breathing and movement.